Good afternoon. I want to thank you all for joining us today. I want to thank General Matt Quinn, the Executive Director of our COVID-19 Task Force, for being here today with me. We'll provide an update on the progress Montana is making in confronting the pandemic and talk to you about our pro-jobs, pro-growth agenda. As you can see from these signs on either side, we are making great progress in combating this pandemic. The news is incredibly encouraging. These trend lines continue to remain very promising. For the first time since September, we've experienced back-to-back weeks where the average daily case count is under 200. Hospitalizations also continue to remain low. Last week, I told you that it was the first time we were under 100 hospitalizations statewide since I was sworn in as governor. Today, I'm pleased to report that hospitalizations remain under 100. As we continue to get shots in arms of the most vulnerable, I'm confident that we'll continue to see these positive trends continue. And boy, we've been successful in getting shots in arms. Thanks to the dedication and the tireless work of our healthcare heroes, Montana is a national leader in efficiently administering the doses we receive from the federal government. Yesterday, data from the CDC showed that Montana had used more than 93% of the doses we've received, the best rate in the country. And this didn't happen by accident. This is a product of the hard work of General Quinn, the staff at DPHHS, public health officials, doctors, nurses, volunteers at the vaccination clinics, and many more. In many of our communities, volunteers are coming out of the woodworks to help take care of their neighbors. I encourage Montanans to take a minute to thank all of these folks. And communities continue to share best practices with each other on how to get these vaccinations to the most vulnerable as quickly as possible. Let's put our efficiency in context. Montana is the fourth largest state in the country, and our communities are different and unique, urban, rural, and frontier. Despite our expansive size, we're getting shots in arms, protecting the most vulnerable, and saving lives. And we won't rest on our laurels. We have many more Montanans to serve as we work on a path to get back to normal. But our success in doing so depends upon the federal government sending our fair share of the vaccine. At my direction, Montana opted into a federal pharmacy program to get more vaccinations to Montana. To ensure that Montana's rural communities have access to these safe and effective vaccines, these doses will be sent to pharmacies in some of our most rural counties. 21 counties have had doses delivered to pharmacies via this new program. As of today, these pharmacies have received 3,100 doses of vaccinations. Since December, CVS and Walgreens have been administering doses to vulnerable Montanans in our long-term care facilities. They've worked to ensure that residents who wanted the vaccine could get the vaccine. Walgreens told me this week that they expect to wrap up their program for long-term care facilities by mid-March. That means they've done at least 3 clinics at each long-term care facility or nursing center. I'll be speaking with CVS again this next week, and I expect to hear good news about their progress as well. The team's doing an outstanding job distributing vaccines, getting shots in arms, protecting the most vulnerable, and saving lives. We'll keep up that effort. I want to emphasize that we still face an economic pandemic. Folks have lost their jobs, paychecks, and some still remain out of work. Montana small business owners have had to close their businesses. And too many Montanans are struggling with the isolation this pandemic has brought. We've taken steps to improve the climate for small businesses and workers. We lifted arbitrary restrictions that 2 small businesses faced, including hours of operation and capacity limits. It's hard for a server to earn a living when the restaurant has been shut down or when tables are empty. Many counties, which initially chose to keep these restrictions in place, have followed the state's lead and lifted these arbitrary restrictions. We also signed a law to protect small business. Nonprofit organizations, places of worship, and healthcare providers from lawsuits if they make a good faith effort to protect individuals from the spread of the coronavirus and follow clear public health guidelines. Local jurisdictions can still determine policies that work for them because each county is different. What may work in Gallatin County may not work in Garfield County. But we have more to do to get our economy going again, get Montana open for business, and get Montanans back to work in good-paying jobs. As I promised in the campaign, that's one of my top priorities. I'm encouraged by the progress we're making to deliver on our pro-jobs, pro-growth agenda to make Montana more competitive. Just yesterday, the Senate passed 2 of our signature Montana comeback bills. The Senate passed the Montana Entrepreneur Magnet with bipartisan support. The measure encourages companies to establish their headquarters and create good-paying, long-term jobs right here in Montana. The Senate also passed the Competes Act, which makes our top income tax rate, which is currently one of the highest in the region, more competitive with our neighbors in the Rocky Mountain West. The Competes Act cuts the income tax rate prudently and incrementally as our economy grows and we can find efficiencies in government. The Montana Entrepreneur Magnet and the Competes Act will make Montana more competitive and bring good-paying jobs to our state. Earlier this week, the House also passed the Montana Trades Education Credit, MTEC, with broad bipartisan support. The measure will empower our workforce by offering businesses a 50% credit for their employees to learn a trade skill. Working together, employers and employees can decide on training that's best for the business and the employee. I'm encouraged by the progress the legislature is making on pro-jobs, our pro-growth business agenda, and this will help lead Montana's comeback. Finally, I want to conclude this press conference. I want to let everyone know you should take your mom fishing on Mother's Day. Yes, it's more than 10 weeks away, but this week I signed Senator Pat Flowers' bill into law that makes fishing free on Mother's Day weekend. For those of you thinking about it, flowers might still be a good option, but I think fishing's a good one as well. With that, you can cast your lines, and I'd be happy to take your questions. Who'd like to go first?
I don't know who came up with that last one, Governor, but anyway, my question, it might be a little more directed to General Quinn, but we're seeing some reports that the Johnson & Johnson vaccine is getting close to that FDA approval. I saw a tweet this morning from the governor of Connecticut already starting to allocate potential doses for the coming weeks. Have you received any preliminary or provisional kind of basis on how many more vaccines the state might receive as a result of Johnson & Johnson?
Yeah, first I'd say I'm encouraged that American ingenuity is now producing a 3rd vaccine that hopefully will help us fight this pandemic. General Quinn, would you like to address the specifics?
Yeah, so as it relates to the Johnson & Johnson, I think we're going to get more information this week. As we've talked about in the past, every Tuesday, CDC comes out and says, Montana, here's the quantity that you can order. Johnson & Johnson was not included in that order quantity this week. We have an expectation about 1 million doses, we understand, will be released by Johnson & Johnson the week that they finally do come out. And so we'll see a prorated share of that, maybe 1,000 doses, 1,500 doses probably. But no specifics as of yet, but we're looking forward to more doses in Montana getting in the arms.
And just to follow up on that for you, General Quinn, obviously the governor's been writing to the president, amongst other officials around the country. Is there any increase percentage-wise or numbers-wise that Montana is seeing in that allocation that you've been alerted to for next week?
Yeah, so we did see an increase this week, two additional trays of Pfizer, and so we are seeing incremental increases from the CDC based upon what Montanans need.
Thank you.
Governor John Riley, Montana Television Network. My question is actually about CARES 2 Act dollars. It looks like around $300 million have still yet to be officially announced as allocated. Has your office been taking looks at what to do with that or discussion with the legislature?
We are looking at all of the money and making sure we're accounted for the money that was spent and understanding the flexibility we have with what remains. Do we have an online question?
This is Stein from the Bozeman Daily Chronicle. I was wondering if you could talk a little bit about whether some counties are finishing up Phase 1B and if there's a timeline for when they might be able to start 1C, or if some counties might get more allocation in the coming weeks to kind of get all of the counties in line in the same level of Phase 1B.
Yeah, thanks, Perrin. And it is true we're making good progress. You can see that on our dashboard as to which counties. The chart gets greener every single day as we get more shots in arms. We're just beginning discussions about when we can expand. We've gotten feedback from some counties that they're getting to the end of the current 1B group, and we'll need to make a decision here in the next couple of weeks on how we get to the next tier. Is there a question in the room here? Yes, please.
Governor, I understand you signed HB 15 this morning for school funding. Do you have any comment on that passage? And then, as a quick follow-up, I understand the spending increases in the second year over that 2-year period. I think Representative Anderson said in a committee hearing back in January that the schools will be able to supplement the funding in that first year with some alternate sources. Can you comment on those alternate sources?
Yeah, I was pleased to sign the bill to expand funding for K through 12 education. I was here with Superintendent Arntzen for the bill signing, and I'm not as familiar with the details in there, but it does represent an increase. We need to make sure we get the funds to continue to educate our kids well. We'll take an online question. No? Other questions in the room? Yeah.
Yeah. So you had asked the legislature, this is regarding the Born Alive bill, you'd asked the legislature for a referendum to bring that to the voters, but Senator Howard, I believe yesterday, had a bill that would essentially do the same thing but make it immediate, effective upon passage. I believe your policy advisor testified in support of Senator Howard's bill. Do you have a preference on whether you first get Senator Howard's bill or that it goes to the voters?
Well, I respect the legislative process. I was very clear in the State of the State. I support the Born Alive bill. I also support the Pain Capable bill. They're working and winding their way through the legislature, and if it makes it to my desk, I'll certainly consider that.
But you don't have any preference on which one?
We're watching what goes on there. There's a lot of twists and turns in the legislative process, so I try not to wade into all that.
Thank you.
Yeah. Any other questions? Great. Thank you very much.